wonderful testament that it is you do have people on this call that, or on this video chat, that have implemented and have gotten the ANAB certification. And really, I can't state enough how it is important for senior leadership to embrace this, and to take it and be able to champion this within the organization, because ISO 55000, ISO 55001, and then of course utilizing the ISO 55002 to help that is essentially comes into your culture. It isn't a process you keep doing. It is part of your culture. It is part of how you think. It is part of how you run your daily organization, the life of your life of the organization. So with that, I'm going to turn it over to Art, to delve into a little bit more about how they did this at in San Antonio.
Thank you, Tia, and thank you, Mr. Russos, for your presentation as well. So yeah, we're going to talk about why personal property matters. We're going to talk about planning for a personal property asset management system, talk about initiating the program, and then I'll hand it over to Ed Safdie, who will talk about the plant or real property plant assets. And then finally, Frank Gastalla will talk about the internal audit portion of our presentation. So I'm going to start with why asset management matters. Tia mentioned the 30,000 foot view, and really this whole presentation, it's almost from outer space view, because there's a lot that goes into everything that we're going to talk about. And part of that is, and you'll see a little later, that this is really a long-term commitment by the organization to get to the level that we currently are at. And so I want to define personal property, because when you ask what is asset management, it really depends on who you're asking and what their objectives are. So for example, if you just Google asset management jobs, you're going to get a whole lot of pages worth of different areas of asset management, anywhere from the financial market portfolios, as you can see, I have listed in there. But so what we're going to, my portion of this presentation is specifically going to focus on personal property. And so if you think of moving from one location to the next, all of those things that you can take with you, that's personal property. And as Mr. Russo said, in a hospital, particularly our hospital, that's a lot of stuff. So if you could, next slide, Tia, please. And so just to further define why it matters, we'll just focus on the spending part of it right now. What you're looking at is the U.S. Census Bureau from 2016, 17, 18 on capital expenditures across industries. And so one of the things that is you can see too is that every year that spending only gets higher. It just increases. And in 2018, which is the most recent that available, industry spent $1.7 trillion on capital expenditures. So, and the thing you have to remember here, though, is that this is just capital expenditures, and every organization sets their own capitalization threshold. So the spending, if you include expenses, those things that fall under the capital threshold, this is really a lot more. It may even be twice as much in spending as you're looking at that you see here. And in healthcare alone, the spending for capital was 108 billion, and again, that's just capital spending. And if we look closer at that 108 billion in spending in healthcare, Tia, next slide, please. You'll see that it's broken down into structures and equipment. Healthcare is defined by the US Census Bureau, is made up of a lot of other little sectors from, physician offices down to daycare services. But you can see by the chart that medical and surgical hospitals really make up the bulk of this spending. If we just look at the structures and the equipment, so structures is, it's all property, right? So the structures part of it would include the rent, lease payments, things of that nature. And then the equipment is where I'm focusing on today in my part of the presentation, is that personal property part of it. Also, I just wanted to, if you could just go back, just kind of put things in perspective in terms of the amount of spending. Most organizations probably will rank their human resources or wages and benefits as the highest cost that they incur. But next to that, when you is normally property. And when I say property, I'm encompassing it all. Like I said, the rent payments, the buildings, the personal property, everything is usually second next to wages and benefits. So it's a very significant expense that the organization incurs. And when we look at wages and benefits, or I'm just going to say human resources, look at the things that an organization puts into it, because there's a human resource life cycle, everything from budgeting to for a new position, to creating a job description, to advertising for candidates, to interviewing candidates. And then there's probably an onboarding orientation, there's on-the-job training, there's continuous education, performance evaluation. It goes on and on. In some cases, there's even exit interviews at the end. And so we inherently understand why so much is put into the human resource life cycle, considering it's the #1 cost most organizations incur. For property, which is, like I said, in most cases, the #2 cost, there's also a life cycle from a need of the property to all the way through its acquisition and disposal. So we need to take a look at what we're doing for the property life cycle, and that's what we're going to get into a little bit here. Just another comparison with property, with equipment and structures. It's a little bit misleading because with structures, that's normally a one-time cost, not including upkeep, but to build a structure, which lasts maybe 40 years. And in that time, the personal property, the stuff that's inside that structure, may be going through refreshes periodically. So for example, a building that lasts 40 years, if you refresh your computer equipment, let's say every 3 years, that's 13 refreshes during the life cycle of that building. So you can see how over time, personal property may even overtake the cost of real property. Next slide, please. I was going to go into a little bit more about the cost of personal property and the savings, but I think in managing your personal property, but I think it's just going to come out during the rest of my presentation here. So you have in a hospital asset-intensive departments, and so, for example, biomedical engineering we hope is managing medical equipment. Information technology, we hope, is managing their information technology. But do we really know for sure that this equipment is being managed optimally to get the most value from them. Excuse me. And so there's a lot of departments that we hope are managing their equipment appropriately. But what we put into place here in University Hospital is a mechanism to ensure that these departments are managing their equipment efficiently. So Tia, if you would. And so this helps more than just in just efficiently and cost savings and things like that. It's like Mr. Russos was talking about earlier about being able to focus on patients. So just for an example of that, if you have a clinician on one of our patient floors that has an issue with a piece of equipment, without asset management and an asset management system, who do they call? Well, they'll probably, what they do is they probably take their best guess, and they may call biomedical engineering, who may in turn tell that clinician, well, that particular equipment is managed by information technology. And so the clinician calls information technology. And here at University Hospital, there's a lot of smaller departments that fall under information technology. You have the field engineering and the data center and infrastructure folks. So it might be a day or two before anyone from information technology can get back to the clinician. And then once they finally do, they may find out, well, that piece of equipment was brought in by, the project management office, or, who knows. So there's a lot of efficiency to be saved if there's just one centralized conduit where the entire organization can connect with to get asset information. Next slide, please. And so it's really important to understand that asset management is not an asset management system. So like, as in I stated on, regarding the previous slide, you're hoping biomedical engineering is managing their biomedical information, and you hope that that IT is managing their information, and so on and so forth. But that is not an asset management system where it all begins at the top, as Mr. Russo's pointed out in the beginning. It has to be driven, well, it's driven from the bottom to present the need to senior leadership, but then from there they have to embrace it. And so it begins with that corporate policy and strategy. And that's where you build your asset management system from, because your asset management policy and your asset management strategy it is designed to support the corporate strategy and policy. And then you get into the processes and the plans and the procedures to the asset life cycle, from acquisition through disposal. And then you apply that to your asset portfolio. Next slide, please. And so you have to think that it is very important to understand that this is a long-term commitment. It's not something that you just would allocate or designate for a staff level person to implement. And it's not really because the staff person is not capable. It's really because if that staff person was so well qualified to implement a system, an asset management system, there's a good chance that they will find another position before their mission is complete. So this has to be supported by senior leadership and implemented by someone in the middle that's going to be around enough and long enough to see this through. And along with understanding what your corporate policies and strategies are, you have to, why it's important to know what an asset management system is because you have to know what you want. You have to know what the end game is.
So I was just going to add into what Art was talking about. If you see his his graph on the lower right hand side, I cannot really emphasize this enough. The level of support and the staff, as you see, it's years to mature. It's very important to understand that this doesn't happen overnight. This is going to be a cultural change. It does need to be from your C-suite. It needs to be championed by somebody, as Art said, that will stay within your organization. And it's not only somebody within your C-suite that, only one person, but the whole C-suite really needs to be in on it. Because I've been in organizations where a CFO, for example, has championed something, and then as soon as he or she leaves, that whole project or program goes by the wayside. What it needs to happen is that in the beginning, it does need to be all of that senior leadership who understands what it's going to take in order for the organization to develop a strategic asset management plan, number one, and then how to implement it, and then at the end of the day, how they're going to sustain.
Yes, exactly. And that also is the reason why you don't really want to delegate this to staff level to implement, because as you saw a few slides ago, there's a lot of individual asset intensive departments, and without asset management, they tend to operate within their silos. And so the only way those silos get to be broken down is they have to understand that this is driven by senior leadership, and that's when the silos begin to lower the walls. So how do you get senior leadership to buy into putting together an asset management system? Well, there's a few ways to do it. The first thing, though, is you have to know, like I said, what an asset management system looks like, what it is. And then you have to be prepared to talk about it when an opportunity arises. So those senior leaders, they're concerned about those hundreds of departments that fall under them. So they're not really focused on asset management like I am, and like you may be. And so when you need to be able to sell your idea very quickly when the opportunity arises. And some people call them an elevator pitch. So you have to know what to say, and who to say it to. Excuse me. So it might be something very simple like, I'd like to implement an international standard for managing our personal property. This will help ensure that we get the most value from our asset investments. And so you're likely going to get one of three responses. Either they're going to tell you, hey, that's a great idea, let's go for it. And then you're off to the races. You might get a response like, that sounds like a really good idea. Let's talk about that when I have some more time. And then finally, you might just say, this isn't the right time for us to do something like that. So what you're looking at on the slide now is in the event that you get that middle response where, that sounds like a good idea, let's talk about it. And so here's where you have to get all the details in place and talk about what you want to do, what the objectives are, how they align with the overall strategy of the organization, what success looks like, what kind of constraints are you up against where you need senior leadership support, and the stakeholders are that would be involved with this. And so if you could go on to the next slide. And this is just an example. I just Googled it. I'm sure there's lots of examples of a project charter or things that you can use as a project charter to help convince senior leadership that this is a good idea if they're interested in it. And so, like we said earlier, this is a long-term commitment to initiate. And these things do not need to be, they don't need to be implemented in a sequence. A lot of this stuff can be done at the same time. And so some of the basic tools that you're going to need is an inventory database. And I'm not talking about an Excel spreadsheet. I'm talking about a database. So they range anywhere from very inexpensive to very expensive. So just depending on where you are in a maturity level, it will depend on what you need, and some data collection equipment, barcode, things of that nature, a work order system, because it's going to take a while to get an accurate inventory. But once you do, you want to maintain that accuracy. So one of the things you don't want to do is do an inventory first before you put your processes and procedures in place, because doing that will just render your inventory totally inaccurate once it's done. So you want your policy, your procedure, your strategy, your plans, the processes and procedures throughout for each phase of the life cycle. You want all of that done before you even attempt an inventory. The work order system, that is something in place for once you have an accurate inventory, the rest of your organization can keep you informed of what's going on with the personal property. It's a place where they can go to ask for something to be relocated or to disposed of, and things of that nature. And then the intranet website, a lot of companies, they have an employee-only intranet, and that's where we at University Health System have our work order system. So anybody can just open their browser and click on asset management and submit a work order to make it real easy. But one thing I want to point out on this slide is, so you can start implementing a work order system at the same time you're working on developing your process and procedures. These things, they don't have to be done again, in sequence. They can be done simultaneously. Next slide. And it's important to engage the entire organization to get buy-in from everyone, from senior leadership to each individual asset-intensive department. And the way we did that is we created an asset governance committee with those asset-intensive departments to begin with. Actually, when you look at a hospital, you could probably break down the makeup of assets into probably 30% of the stuff is medical equipment, 30% of it is IT equipment, 30% of it is furniture, fixtures, and artwork, and then the remaining 10% is just a variety of stuff. But so for an asset governance committee to start, you can just have a representative of biomed, IT, and hospital administration, and that would cover like 90% of the stuff in the hospital. And that's what we did. We started with just a very small group. And what we do is we talk about each phase of the life cycle. And we meet quarterly in our asset governance committee. And we talk about each phase of the life cycle from budgeting to acquisition through warehousing and disposal. Every organization is probably going to have to define what their own life cycle is, but we have about 7 different life cycles, and we talk about them all. And we talk about the risks and opportunities in each one of those life cycles. And then over the years, as we meet, we discover that we need other stakeholders involved in our asset governance committee. And so that's grown to include even protective services and environmental services and other departments within our health system. And so after me, Frank is going to talk a little bit more about those risks and opportunities. But the other thing that we did is we created, and Mike talked about it in the beginning, an asset management advocate program. And so we did this, it's sort of like a fail-safe to help us understand and that our process are working. It's kind of like the catch-all. And we kind of modeled it after the safety program. And you know, a lot of organizations, they have a safety program where when the fire alarm goes off, the safety advocate will hold up their card, whether it's a letter or number, and then those people that fall under that letter or number will follow this person out in the parking lot, and they'll stay in their designated area until they get the all clear. So this is kind of modeled after that, where each department will have an asset management advocate, sort of the eyes and ears of the asset management department. And what we do is every month, we send out it's a survey monkey, and we ask them just a few simple questions regarding their personal property to see if our processes are working. Things like, you know, did you receive any assets that didn't have a tag on it? Did anybody move to a new location without the assistance of a support department like IT or asset management? Did anybody return any assets without getting a RMA number from procurement? And so, you know, ideally, all the answers will be no, but we do get a handful of yeses, and that's when we'll contact these departments and we'll get more detail. But what we ask of our advocates is that it's not their answer per se, it's a collective answer from their department that they're representing, because our departments, they meet, some of them daily, some of them weekly, some of them monthly. And so our advocates bring these questions to their department meeting for a collective answer, because not any one person might not know the correct answer. So there are no correct answers really, or there's only honest answers. And that's what we ask for from our staff. And this is how we engage our entire organization and have buy-in, and they understand how important personal property is to the organization.